Biggest game changer for me is working in local government, having our municipal public health plan incorporated into our council plans. So the focus is about health and wellbeing for the community.
The biggest game changer in South Australia has been the political support we've received from our former Minister, John Hill, and the ongoing support we've got from state government. The political support we have from a federal level with the federal government through the NPA-PH funding, and of course our political support that comes with the 20 councils that we're working with in South Australia and also in Northern Territory.
I think one of the game changers for prevention is leadership. We have a lot of evidence out there, but are we all working together to make sure that we're trying to achieve evidence-based practice in prevention, whether it's obesity, physical activity, health promotion in general?
I think one of the game changers for prevention has been the change in the conversation in both the community and in the media. People are now talking about health, they want to know more about health, and the media's decided that it's actually news now.
The biggest game changer in our experience is the political support at all levels, from the local level with the mayors, especially in Europe, to the national level with the ministers. And it's very important to have this support because the EPOD methodology is a multi-stakeholder approach, and we need the involvement of the whole of population of the city, and the mayor is a very good champion to do that. And we need this political support, and we need also the national or the state political support to change policies and regulations.
Possibly the biggest game changer for us was the arrival of Jamie's Ministry of Food mobile kitchen in April this year. So one, it not only gave us an opportunity to build our profile with our local community, show them some tangible outcomes for what we were doing, but it was an absolutely fantastic way for us to engage internally our department, get people to think about how to leverage all of these opportunities. It built partnerships with local community organisations, with local schools, a bunch of local community volunteers and members. We've now got over 130 community members on our Health Champions database, and 30 of those have been formally trained through orientation. We've also developed a really strong partnership with our local library network, and they're now supporting us through some of our place-based work, especially the implementation and rollout of the infant program. So for us, it was a real momentous game changer point of time for us.
Some of the biggest game changers for prevention for me that I've seen in Geelong is the state government investment through Healthy Together Geelong. Without question, it's the biggest thing that the city's ever seen. It's the biggest thing the region's ever seen, and it comes with a task to bring about change, a task to disrupt, a task to ask those questions that people haven't been brave enough to ask before, to bring about a better way of being for people. And I think that mandate to act, the mandate to be responsive to the local system has really been the game changer to enable us to do the work we've done.
I think the biggest game changer for me has been the opportunity to meet so many like-minded, passionate people that want to change the world and change the health of Victorians.
I think the game changer is that we're all having a conversation and that we're all responsible for obesity prevention, and I think we're advocates for taking it out further than the conference today.
I think without doubt the biggest game changer would be seeing local government lead on preventive health at a municipal level, a local government level. I think that the levers that local government can pull are many, and I think that we are already seeing the reach, the breadth and depth of what local government can do when they've got the green light.
Individual organisations and agencies coming together to work in collaboration, without a doubt, to get efficiencies through combined activity at a local level. It's on a local community level, it's probably one of the best things you can possibly do.
One of the biggest game changers for me has been probably a combination of the funding. So the funding model. We've not had a funding model like this in health promotion before, so I think it's provided us with the ability to have, which is another game changer, is the workforce. So it's enabled us to have a hugely skilled, well-rounded workforce. It's allowed us to implement a huge amount of community-based initiatives and hopefully also change the way that local government does prevention.
One of the biggest game changers for prevention for me today is actually hearing the medical advisor from the Department of Education talk about the achievement program like it's really important and valued by the education system in the way it's going to help educate and promote health and wellbeing in early childhood services and primary and secondary schools.
The biggest game changer for me in a really long career has been the opportunity to be the only health agency at a table
with everyone else, non-health sector, championing our message.
The biggest game changer for prevention from Cardinia Shire's Healthy Together would be the leadership. Genuine leadership from the CEO, who is really passionate about health and wellbeing, and it's his top priority. And I guess that's facilitated us in terms of looking at the council plan and really embedding health and wellbeing in everything that we do at council.
The biggest game changer in Victoria, and in fact anywhere, is when you get high-level political leadership getting the problem, getting in behind it and arguing for the funding and the policies to come through. We've seen it in Victoria, bang, it happens like that and it keeps going. As soon as you lose that political will, it's gone. So we have to keep supporting our leaders.
So the biggest game changer for prevention for me, from the Education Department's perspective, is the real depth and breadth of collaboration between the Department of Education and Early Childhood Development and the Department of Health. For the first time, even though the rhetoric has been there for a long time, we really are taking a very strong holistic view of children, young people, and really looking in depth at the settings where they live, work and play to be able to really affect prevention on a range of different issues over time.